Welcome this morning, guys. Thanks for tuning in to this little presentation on headaches and migraines. I know it's a beautiful day out there, so we'll make this as concise and speedy as possible so you can get out there and enjoy your Saturday. Again, my name is Dr. Andrew Martin. I'm a chiropractor with ProTX out of our Elmsdale clinic. And again, today, as you can see, I'm going to be presenting on headaches and migraines, which is kind of a good spin-off, as Julie had done a presentation fairly recently on neck pain. So they're very similarly associated sometimes. So as we go through here, and again, super not technical. So if there is any issues throughout the presentation, just give me a second. I'll try to figure things out and we'll be all set from there. So initially, I'm going to start with kind of the burdens of headaches globally. And just to give you an overview of what we're going to do, I'm going to talk about some kind of stats and information. Then we're going to talk about the types of different headaches that we tend to see, more so the primary ones that we see in the clinic. And then we'll kind of go through those a little bit more diligently, specifically with those primary headaches. And then as we continue on, we're going to get into the treatment side of things, what you can do at home, lifestyle modifications, stretches, things along those lines that can really help you. So the first little while might seem a little bit technical. I'm going to try to bring it down to just an easy level, but don't fret. We're going to get to some good stuff toward the end as well, and I'll explain things as need be as we're going through it as well. So the burden of headaches globally, 1/2 to 3/4 of adults aged 18 to 65 years in the world report at least one headache per year. So that's a huge number of individuals, and around 30% of that time reported it to be a migraine headache. Headaches seem to be more common in women, most typically around 2-to-1 ratio. Apart from cluster headaches, which is kind of a separate subcategory of headaches, which tend to affect men a bit more than women. Not super known why, but that just seems to be the case when we look at the numbers. A headache on 15 or more days a month affects about 1.7 to 4% of the world's adult population. Again, that's that 18 to 65 years of individuals. So when you think about it, 1.7 to 4% doesn't seem like a huge number, but then when you talk about the world's adult population, that's a pretty large, substantial number. And the headaches are amongst the highest reasons for consulting medical practitioners. So about 1/3 of all neurological consultations, mostly probably with neurologists or your family medical doctor, work for headaches specifically. A little bit more close to home, 9.1, and this was back in 2011. So take that into account with the recent happenings over the last couple of years, people moving to the desk at home, maybe not as ergonomically favorable, a bit more stressors throughout the last couple of years. So that number's probably increased since this 2011 poll. But in 2011, 9.1% of Nova Scotian population were diagnosed with migraine disorder when seeking medical attention for headaches. Continued with the burden of headaches globally. In 2019, the Global Burden of Disease study suggested that migraines were the second leading cause of years lost to disability, behind only low back pain. So it suggested about 85 to 90% of the population will be affected in some way throughout their life with back pain. That's closely followed by headaches. And the years lost to disability is just means that you're unable to perform routine daily activities, or not able to perform the activities that you wish to perform, like going for hikes for a long time, looking at screens, hanging out with family and children, grandchildren, things like that. So that's what they mean when they say years lost to disability. Direct and indirect socioeconomic costs of headache to society are estimated around 14 billion per year, and that's just in the United States. So that's a massive number, and with a condition that is very commonly treated with conservative care, medications, things like that, that number could be greatly diminished if we were to see more people present to the clinics with their headache symptoms. And this is just for the United Kingdom, but again, a really good number, more so along the socioeconomic side of things. Around 25 million working or school days are lost every year to migraine alone. So that's not bringing in just general tension type headaches, and the MOH at the end there means medication overuse headaches. So if those were factored into, that could even double with those additional headaches combined. So again, very large impact in the socioeconomic side of things with headaches. So now we'll get into the types and classifications of headaches. So there's, if you break it down to brass tacks and really get nitty gritty, there's around 150 different types of headaches. The primary and secondary are typically how we tend to break them up initially. And the primary headaches are just kind of no known underlying cause. They just kind of present themselves, and there's no specific thing that might have actually caused it or been associated with it. And then the secondary headaches are a result of another condition or secondary cause, causing traction or inflammation, pain-sensitive structures, whether it's in the shoulders, mid-back, head, neck, brain, things like that. So what we're going to talk about more so today are the 4 primary types of headaches. You've probably heard of all of these in some way, shape, or form. Tension type headaches are one, cervicogenic are another, migraines, and then medication overuse headache, which it's a fairly new category, but it's gotten up toward the higher end of prevalence when we speak about the type of headaches that do present to certain clinics. Other ones you might have heard of that we're not going to speak on too much today, but again, you might have heard of them or actually experienced it yourself: suboccipital neuralgia, sinus headaches, TMJ related headaches or tension, and cluster headaches. So we'll go right into the 4 primary types, starting with the tension type headaches. This is commonly described as just a pressure felt throughout the entire head, or like a band wrapping around symmetrically from side to side. So it's the most common type of headache that we tend to see. Episodic is, again, the most common frequency of the tension type headache. So that's just between 1 to 15 days per month that people experience those symptoms, and that's around 70%. The chronic type, again, we see a much smaller percentage in that sense, but that equates to about 15 or more days per month. So about half your year or half your life with the tension headache. So we see a lot less frequency with that, most likely because people are seeking medical attention, because it gets to the point where it gets really annoying for them. Again, like mentioned before, classic presentation kind of starts around the back of your head, that suboccipital region right below the base of the skull, and sometimes spreads forward into here, or it can even kind of wrap around the front of the head as well. A band of dull pressure or squeezing pain around the entire head. Usually affects both sides equally, and the muscles in your neck, shoulders, jaw can sometimes feel tight and sore with the onset of a tension type headaches, or vice versa. Potential triggers and causes can be multifactorial, but fatigue, stress and tension, anxiety, dehydration, eye strain, hunger, smoking, poor posture, etc., are among the main causes of tension type headaches. Now, with tension type headaches, again, it's usually derived from some sort of muscle tension around the head, neck, mid-back area. So we're going to go into some of those. We're going to go into some of those contributing muscles that could be associated. We tend to see a lot of association in clinic. A few different muscles here. I'm not going to go over all of them, but I'll go over a couple of them, and a few you might be able to recognize yourself. So the first one if you're looking at the screen, far left in the top corner, the masseter. That's that muscle right here in the jaw. If you're to clench your teeth, you can kind of feel it poke into your fingers, and you can see the red portions here are the referral patterns that we tend to see with muscular tension of that nature. So at the bottom of this little depiction here, you can see Travell and Simmons are the 2 names at the start, and they're very influential individuals in the research world, specifically to referral patterns. So whenever someone talks about referral patterns, it typically means there's a structure causing an issue, but the discomfort or the pain is realized elsewhere. And it's pretty cool within practice, once you realize and recognize these referral patterns, then, I can press on somebody's muscles in the back of their neck here, and they're getting some pain right behind the eye. Sometimes I'll even press on like muscles of the shoulder blade, and they can feel it right up into the neck. It kind of comes around the ear into the front of the head. So there's certain muscles that cause more or increased discomfort than others. So the masseter is definitely one because of that TMJ tension that we tend to see with most people. Semispinalis capitis and the splenius capitis, those are just 2 muscles. When it says capitis, it basically means, and you can see by the splenius capitis there, it basically means that it attaches to the base of the skull. So a lot of times the muscles that do attach to the base of the skull create referral patterns along the lines of the tension type headaches. Another common one we see down in the bottom left-hand corner, there's two different depictions there because the muscle has two different heads, but it's the sternocleidomastoid, or the SCM. A lot of different with the X's there, a lot of different trigger points that you can see. But again, there's a lot of referral patterns that tend to happen from the sternocleidomastoid. So that's that muscle. If you kind of stretch your neck back and away, you can notice a couple different bands that tend to go up all the way behind the ear, down from the clavicle or collarbone up through that area. Very commonly associated with like motor vehicle accidents or whiplash type disorders. That muscle tends to be really heightened in sensitivity with those whiplash type movements. The suboccipital muscles right in the middle on the bottom of that depiction are also very commonly associated with the tension type headaches, as you can see from the referral pattern that they present. Those are the deeper muscles in that same general area here, but you really need to dig in there to get to those suboccipital. So those muscles actually attach to the vertebrae themselves. There's 4 specific small ones, but again, they can cause a lot of referral discomfort and a lot of those tension type triggers. And then I also mentioned that sometimes you can even feel it from the shoulders. So the last depiction there on the far right bottom side of the upper trapezius, that's that muscle. If you kind of grab the meat right at the top of your shoulder, a lot of people say that, you know, their shoulders are kind of, they're using their shoulders as earrings sometimes. That's the muscle that tends to get pretty tight there. And as depicted again by those red referral patterns, you can see some of those trigger points causing discomfort up through the back of the neck and then into the head as well. So that's it for tension type headaches. We'll move on to the cervicogenic type headaches. Now with the tension type headaches, a lot of those typically stem from muscular tension. The cervicogenic headaches typically tend to arise from the joints of the cervical spine or of the neck. So again, don't look too much into these pictures too much because they're a little bit increased detail. I'll just explain kind of the mechanism behind it and what we tend to see in the clinic as well. So with the cervicogenic headaches, they're not as common, but they're definitely more common than people think. And they're usually derived from joints of the cervical spine. So as you can see on that picture in the upper right-hand corner, that's just a depiction with the vertebrae and no muscles associated with it. And there's different joints that attach each vertebrae as they move down in levels. So typically we see the cervicogenic headaches arising from the top 2 vertebrae, which look a little bit different when you go from the base of the skull and just down from there. Those 2 joints, they create a lot of rotation and a lot of lateral flexion and a lot of flexion extension through the head. So any increased irritation from sleeping with pillows that might not be suitable for the neck, or quick movements where you just kind of get a random kink and you're not sure where it's from, typically those are the joints that those arise from because of the amount of range of motion that they create. So some of the symptoms and presentation, again, waking up with headaches or pain on one side of the head or even behind the eye, because those joints have a lot of association with the nerves that come right behind the eye itself. So that little diagram on the bottom left-hand side of the screen here now. Again, Travell and Simmons, with the referral patterns that we were talking about before, they would find a muscle or a joint, they would inject a saline type solution into that joint or muscle, and then see what the referral patterns were that were reported from the individuals that they injected the saline into. So as you can see, moving down in the joints, the vertebrae throughout the neck, you can see the top, far left-hand diagram there. C2, C3, that's closer up towards the upper part of the head. There's a lot of referral patterns that come up into the skull and around into the front of the head or into the eye. As we move down the vertebrae just by one section, C3, C4, that typically comes more toward into the shoulder or the back of the neck. And then as we keep going down, you see the patterns tend to create a little bit more discomfort further down the neck or even into the mid-back and into the shoulder blades. All right, so next we'll move on to the migraine headaches. So there's no significance or no real known cause of migraine headaches. There's many contributing factors that may include fatigue, dehydration, inflammation, weather patterns, genetic factors, hormonal changes, increased inactivity or increased heart rate or blood pressure, overall stress, medications, etc. Typically, they're thought to be more of a neurogenic component. And that's why a lot of neurological complaints to family doctors or neurologists tend to be along the migraine side of things. Again, women tend to experience migraines a bit more commonly than men do. And additional characteristics that make migraines a little bit more uncomfortable or irritating would be the one-sided effect. So that's one of the common characteristics. It's more of a one-sided type irritation with migraines. They can be presented with an aura, so kind of like the halo type sensation around the head, or even the fuzzy stars that you might see sometimes. Photo and phonophobia. That just means sensitivity to light or noise, and potentially nausea or vomiting as well. There's multiple types of migraine headaches again, so it can be hormonal based, vestibular based, so it could be within some of the nerves of the brain and inner ear, some of the fluids within the inner ear as well. Hemiplegic just means one-sided, or you get some reduced sensation in one side, and ophthalmic means more derived from the eyes, and that's where the migraines, so the nerves from the eyes, that's where those migraines come from. You can see that little picture there. It just shows all of the nerve pathways throughout the skull. So there's a multitude of areas and specific nerve pathways that could create those migraine type headaches and symptoms. And the last one that we talked about is medication overuse or rebound headaches. Not a whole lot to mention about these here. They're pretty self-explanatory, but they're very cyclic in nature. So typically somebody might present to their family doctor or neurologist or wherever and get some medications for their headaches. Typically either doesn't do a whole lot, or they feel like they need some more, so they go back, they get some more, and it's kind of a cyclic type nature in that sense. So obviously, us as conservative healthcare practitioners, we're trying to stay away from the medication side of things. That's not to say that medications aren't beneficial in certain instances, and they very much are. It just needs to be recognized, what is potentially causing these issues here, and what route might be the best suited for that individual that presents to the clinic. All right, so these are some things I always like to go through with people, and there are things that a lot of us practitioners tend to look for or note as well when people do present with any neck pain or headaches. And these are the red flags that are associated with headaches. So they're things that aren't necessarily, you have to go to the ER right away, but they're things we take into account with our treatment plans and with how we want to actually go through our plan of management with these people if any of these associated red flags do present. So we typically go through the 5 Ds and 3 Ns. So the 5 Ds up top there, we always ask about, is there any dizziness that's associated with the headaches, any diplopia, so just double vision, any drop attacks, so any random fainting attacks or things that you haven't seen in the past, dysarthria and dysphagia, so trouble speaking or trouble swallowing. We always want to take note of those as well. The A in the and stands for ataxia of gait, so just off balance gait that you haven't really noticed in the past. And then the 3 N's are the nausea, nystagmus. So nystagmus is something we look for as practitioners. It's kind of twitching of the eye itself, and then numbness. So any numbness, like the hemiplegia, any numbness within the face, into the arm, into the shoulder, things along those lines. These are things that we typically look for, and we'll take into account, if somebody may present that needs different treatments as opposed to just the conservative side of things. Also, a new or the worst headache you ever experienced. Those are typically things that we tend to look out for a little bit more as well. Significant neck pain or stiffness along with a headache is definitely something that we want to take into account. And this is kind of leads to our importance of a clinical assessment. Because if you don't have an in-depth assessment with a practitioner, then there could be, the plan of management could be just not properly laid out for that individual, what they're experiencing. All right. So now we'll go into the treatment options for headaches, and there's a lot, again, a multitude of things that people are able to seek out. Obviously, conservative management is going to be the first one that we talk about and look for here, because it avoids the use of medication. Again, not the medication isn't beneficial in a lot of instances, but conservative management would obviously be the way that we would prefer people go. So there's no, secondary upsets or associated symptoms with the medication use. So that can be chiropractor, physiotherapist, massage therapist, osteopath, things along those lines. Prescribed or over-the-counter medication, again, those typically tend to work. And we see a lot of people use the over-the-counter medication first if that can reduce some symptoms. People tend to use those quite often, but if they, again, get some associated symptoms like stomach upsets or whatnot, then we see people present to the clinic and see if there's any way we can do some things with our treatment to reduce the amount of over-the-counter medication that they can use. A lot of new things, a lot of alternative prescriptions are being prescribed now. So CBD oil being one. I've heard a lot of people have success with like peppermint oils or different essential oils too, placing them behind the head, again, in those suboccipital regions, kind of around the temple regions, things like that. Vitamin and mineral supplements, especially within Canada. A lot of people don't tend to get sufficient vitamin D, and there's a few different vitamins we tend to recommend, like vitamin B12, magnesium, that tend to help a lot with reduction in muscle tension and subsequent headaches as well. Cognitive behavioral therapy could be a very beneficial therapy to add into your treatment plan as well, help with headaches. And then lifestyle modifications are among the biggest thing that we recommend, because we can only do a certain amount in the clinic to help kickstart the reduction in symptoms and irritation. But if you keep continuing to do things throughout your daily life that might be causing those symptoms, we're kind of going one step forward, two steps back kind of thing. So that's the education and lifestyle modifications are a huge aspect of our treatment plan as conservative care practitioners. So as we continue on, treatment options, again, the conservative management was the first one that we had mentioned, and I wanted to kind of dive a little bit deeper into that because that's our realm of expertise. So the conservative management and what you can expect if you do present to the clinic with some headache symptoms or even neck pain, and this is kind of what an assessment would look like from one of our practitioners, whether it's chiro, physio, massage, all that. So it obviously starts with an in-depth clinical assessment by whoever or whatever physical therapist you tend to see. So patient history is the biggest portion of our actual assessment when we go through that. And it usually gives us a really good indication of the mechanisms, what could be associated with the discomfort, where the discomfort could be coming from, and just how it presents throughout your day. So those are some of the questions that we would ask, like the duration of symptoms, the mechanism of injury, the aggravating factors, things along those lines. Those really help us get a clear picture of what we want to add into our treatment plan or plan of management. Then we'll do a vitals exam. So especially with headaches, we want to make sure that there's no underlying cause systemically that might be causing some of these headache symptoms. So we'll do a blood pressure check, we'll do a heart rate and breathing rate check. Sometimes we'll even look into the cranial nerves, just so that that we're making sure that none of those symptoms are presented from those neurogenic type structures. And then we go into a physical exam. So that's just the basic neck range of motion, neurological assessment. So we'll test the sensation of the skin from the joints and the nerves in the neck. And then we'll test the strength of the muscles, again, that are associated with the nerves in the neck, and deep tendon reflexes. So most people think of the knee, when you hit the patellar tendon, the knee flicks out. We'll do a couple different tests in the upper limbs to make sure that all the nerves in the upper or lower neck are functioning properly. We'll do some palpations. So usually we have the patient lying on their back with the headaches, and we'll kind of poke around into the neck or into the shoulders and assess for any areas of irritation. And then some orthopedic testing as well. So things like what we call the Kemp's test. So if you lean back into the side, you kind of compress the joints of the neck. And if that's irritating at all or even recreates some symptoms, that's a good sign, and it could be coming from the joints of the neck. If we poke on one of the muscles and hold some pressure and that recreates symptoms, we know it's more probably of a tension type headache and things along those lines. So once we do the assessment, then we move on to the treatment side of things. And there's a lot of different avenues that we can go as conservative care practitioners with the treatment side of things. These are the most commonly used or commonly seen implications or additions into our plan of management. So the first one at the top there, again, conservative management can be done from chiropractor, physiotherapist, massage therapist, osteopath, naturopath, things along those lines. So soft tissue therapy is one of the main ones that most people see with almost any practitioner. And that's when you create some tension on a specific muscle or area of muscles, and you go through certain ranges of motion to help stretch that muscle while also applying a little bit of pressure on those areas. The trigger point therapy sometimes has a little bit less of an active component to it, but we'll find those muscles, whether it's in the base of the skull, down the neck a little bit, into the shoulders. We'll apply a good amount of pressure there and hold for about 1 to 2 minutes. And a lot of times we see a dissipation in what people might call a trigger points or a knot or things along those lines that you might find in the muscles that are quite tense and tender. Acupuncture and dry needling is another great addition to headache type symptoms or neck pain symptoms. Typically with the acupuncture, we're putting needles in to the affected muscles and letting it sit for 5, 10, 15 minutes, kind of letting the muscle tension dissipate and the body doing its natural healing process. The dry needling is more along the lines of putting the needle in and poking around into that specific muscle or into those trigger points of the muscles. Sometimes you get a twitch response of the muscle, which is almost like a neurological reset where the muscle twitches and then it relaxes nicely afterwards. Almost thinking like a kind of an AED type thing with the heart. It gives that quick impulse, and then as it comes down, it relaxes. Cervical spine or neck mobilization or manipulation, and a lot of times even into the mid-back as well. So with the mobilization, just taking joints through certain ranges of motion, whether it's rotation, whether it's lateral flexion, whether it's extension and flexion. And then the manipulation side of things brings the popping or the snapping or those noises that you kind of associate with the chiropractic side of things into the equation. So a lot of times they're high velocity, low amplitude thrust, which creates ultimately create a bubble in the joint capsule. And with that bubble, with the quick movement, that bubble releases a lot of tension and pressure buildup that could be associated to some of the headache and neck discomfort that people might be experiencing. Therapeutic modalities are another big thing as well that we add into our treatment plan. So a lot of people have seen a TENS machine before. New massage guns or percussion guns have become a lot more popular since COVID, just with people being at home and trying to do some conservative stuff on their therapeutic modalities on their own at home. And then I put a peanut in quotations, which is a great one that I tend to recommend to people in the clinic, specifically for upper neck tension or headaches. So I'll get a little bit more in depth with that peanut in just a second. Then we go through specific exercises and strengthening and stretching that you can do in the clinic and then at home. And we'll typically send you kind of a video explanation of it all with recommended sets and reps to start. And that'll help, again, just reduce some tension through those muscles and increase some strength around certain areas where we want a bit more mobility as opposed to, or a bit more stability as opposed to mobility with the stretching. And then again, education side of things is, in my opinion, bar none, one of the most important things that we can do. And we take that into account starting right from that initial patient history. And we do a lot of lifestyle modifications that can help increase a patient's quality of life and decrease the amount of tension and irritation they might be experiencing from certain things that could be continuously causing some stressors or irritation. We're going to go into the last three conservative management or treatment things that we can do at home as well. So it's going to be a little bit more interactive over these next couple minutes here. So we'll start with the therapeutic modality side of things. And you can see top right-hand corner is that TENS machine. Just beside that to the left, there's a little bit of a heat pack. The massage gun or percussion gun is just below that. And then if we go far to the far left bottom corner, that's that peanut that I was talking about before. So therapeutic modalities: ice and heat pack, TENS machine, massage percussion gun, and the peanut. So the peanut is the one that I said I wanted to go a little more in depth with. This one I find very, very beneficial for a lot of individuals, and it's very easy to make at home. I mean, obviously you can buy different ones on Amazon and whatnot, but it's even just super easy to make one at home. And I've kind of made one up here just for you guys to see what I've done just with some different things around my house. So I've got 2 golf balls here who are, and I hope you can see that there, 2 golf balls that are kind of taped together into that peanut type shape. And this is what I tend to recommend a lot of people do at home, whether it's tennis balls or golf balls or lacrosse balls. They're a really beneficial tool to help reduce some tension, especially within the upper portions of the neck region. So if you can picture this little peanut here again, and then you can almost feel to the dimples of hopefully you can see there, feel the dimples of the base of the skull there. You kind of put that peanut right into those dimples and find a hard surface to lay back on, and you can put as much or as little pressure as you like with that actual modality or that little peanut. So I'm going to, and let's see if this works. I'm going to click a YouTube video and see what happens if we can get to that, and then I'll kind of again depict a little bit more of what you can do with this peanuts at home. It's there.
This is the sub-occipital release. Lay down on your back with your knees bent and place 2 lacrosse balls taped together under the back of your neck and the base of your head. Once you find a tender spot, begin to perform a chin tuck and then return to the neutral position. Repeat the exercise for 30 repetitions or until the muscle is released.
Awesome. So that's that there, and that was a just for the suboccipital region. However,
in this video, I'm going to explain the phenomenon of referred head.
There we go. Sorry about that. Yeah, so that was basically just for the suboccipital region. However, you can use it down the entire spine as well. So it's a really nice tool to use any tension between the shoulder blades down even through the low back. It's a really nice tool to have in your arsenal just at home as a conservative therapeutic modality. So now we'll go into the cervical stretches and the stretching side of things. I'll show you these 3 here first. A lot of people have probably seen these in the past, but I want to explain a little bit more along the lines of what muscles you're stretching and what kind of referral patterns we tend to see from those muscles. So the first one there at the top is the upper trap stretch. Again, you're stretching the muscles kind of at the top of the shoulder there, that meaty portion, and you're basically, to increase any stretch that you're doing on one side, you can kind of put your hand, as you see in the picture there, behind your arm. So that will increase the amount of tension through the muscles or stretch through the muscle that you're doing. So that first upper trap stretch, you use your opposite hand to the way you're looking to go. Opposite hand, bring it over to the side. With stretching, you always want to stay within a comfortable range. So you don't necessarily want to go full stretch where you're creating pain. You want to feel a good muscle stretch that's comfortable and that you can hold for those 30 seconds. The next one is the levator scapulae stretch. So this one is a little bit different, and this is going for a muscle at the top of the shoulder blade. And a lot of times that muscle will create tension up through the neck and back behind the ear. So with this one here, again, arm can go behind the back. You're going to take your opposite hand and bring it first chin toward your chest. And then you're going to rotate your head to the opposite direction. And you can even bring your head down a little bit further to get a good stretch through that levator scapulae, all the way down from the scapula or the shoulder blade up into the neck and behind the ear. The next one is for that sternocleidomastoid, or the anterior muscles of the neck that we talked about previously. So this one is a bit of a what we call a pin and stretch type maneuver. So if you take one hand or both hands, you can find those stringy type muscles at the base of your neck, just above the collarbone. You can pin those down with some pressure and then look back up to the sky and then away to the opposite direction. And this gives a really good stretch in through those muscles at the front of the neck that can create a lot of irritation up through the back of the ear, and then again around into the base of the skull or around the head as those tension type headaches. The next couple ones is suboccipital release. So as opposed to the the fingers that she's using there, I typically tend to use the thumbs because you can get a little bit more traction with that. So take your two thumbs, find kind of the base of the skull, those two indents there, and then put some pretty good pressure in those two areas there. As you create some pressure, hands can go kind of on the top of the head. Bring your head forward and down, and you can create as much or as little pressure as you want through those muscles. And I would bet if you have some headache symptoms, you can feel that tension as you bring your head down toward the chin, applying as much pressure as you need through those suboccipital regions. The last one there is the rhomboid and middle trap stretch. So this one's more for the mid-back in between the shoulder blade region. Good for people who work at the desk a lot or do a lot of reaching or grabbing throughout their daily activities with work or whatnot. So again, the rhomboid and middle trap stretch, you're just taking your arms straight outstretched and you're just trying to, what we call, protract the shoulder blades and getting a good stretch between those two shoulder blades where the rhomboid and the middle trap muscles reside. So a secondary or an additional thing you can do with these stretches here, and I tend to do this a lot in the clinic, it's called PNF stretching, or peripheral neuromuscular facilitation. So with any of these stretches, as opposed to just holding for 30 seconds in one position, I'll typically tend to do a contract relax cycle. So I'm just going to show you the upper trap one, which is a pretty easy one to do. Again, hand behind the back, if you're able to do so, and then comfortably coming to a bit of a stretch with that upper trap. Now with your opposite hand, you're going to counteract some stress. So I'm going to try to bring my head up this way against my pressure of my hand, but my hand's not going to allow me to go up to that position. So I'm contracting the head, trying to move this way for about 5 seconds, holding it there with my hands. After 5 seconds, I'll relax and then bring that muscle into a little bit of a further stretch. When you find that further comfortable position, again, try to push your head against your hand. So I'm trying to bring my head up. My hand is holding my head where it's at. 5 seconds there. Relax again. And you can usually bring it a bit further. And that's a really good way to get a good stretch throughout those 30-second cycles, as opposed to just holding it in one position. And you always want to do things bilaterally or on both sides. So make sure you're doing the opposite side as well, just to balance everything out. Now we'll move into another slide that kind of goes into that or alludes goes into that side of the hydration side of things. So with the lifestyle modifications, again, this is a huge aspect of what we like to talk about in the clinic and things that can really help increase quality of life, decrease the amount of headache symptoms, neck tension, muscle tension, and all the above. So adequate hydration, 2 to 3 liters per day, or it's 8 to 12 cups a day is what we're looking for. Again, as mentioned before, coffee doesn't count, unfortunately. Great way to start your day. But how I've kind of gone throughout the years to counterbalance that, I'll leave a glass of water on my nightstand, and it's full when I go to bed. So first thing when I get up in the morning, I make sure that glass of water is down and chugged or finished before I have my first coffee, and that's kind of kickstarts the hydration process without just going straight for the coffee first. And usually when we wake up in the morning, we're a little bit dehydrated anyway. So having that water right off the bat is always beneficial. Another thing we tend to see quite often is headaches or neck tension or just general discomfort associated with sleep. So we want to make sure we have an adequate and comfortable sleep. So comfortable mattress, pillows that are properly placed and comfortable. And we look for at least 8 hours per night of quality restful sleep. So that's not 8 hours in your bed and then you're up. This is like 8 hours of quality restful sleep. You know, you can get up once in a while if you have to use the washroom or whatnot, but still getting a quality sleep throughout those hours. There's a great book called Why We Sleep. Dr. Matthew Walker, I believe, is the author, and it's a really great read. He makes it super simple to understand, brings up a lot of good research on why sleep is so important, and even how, you know, 1 or 2 hours of reduced sleep can affect people's lifestyle or overall health to a great degree. There are individuals just genetically who possess a very small amount of people who possess the genes that allow you to function optimally and not see too many health detriments with less sleep. However, that percentage is about 1 to 1.5% of the population. So for the majority of us, we need at least 7 to 8 hours of sleep, quality, restful sleep throughout the night. Stress reduction techniques is also huge as well. So, you know, a lot of times we're seeing people come in who are stressed from work and working all day and always on a computer and don't have any time to get up and move around. Definitely understand, you know, sometimes you get in a groove and you look up at the clock and it's 3 hours later and you've just kind of banged out a bunch of good work throughout the day. But micro breaks is a really good additional activity to add into your daily routine, just to help decrease the amount of tension you might get through certain muscles. And, you know, variety is the spice of life. So moving from your desk, getting up, taking a little walk around the apartments, going for a glass of water or the house, going for a little walk throughout the day, or even just changing positions in your chair. So if you find you're sitting, you know, a bit closer to the screen with your arms, shoulders elevated, try to relax a bit, maybe sit back a little bit and do some work from there. Just changing of positions is always beneficial. Diaphragmatic breathing is another one, really good for stress reduction, and it's also good to reduce tension through the shoulders. So if you look towards an infant and their breathing techniques, they always have that huge belly, and they're always breathing from their belly, and that's the natural way which people are supposed to be breathing. But as we age, as we go through school, we tend to be in that seated position, and people tend to breathe more through the chest and through the shoulders as opposed to through the belly itself. So diaphragmatic breathing is a really beneficial way for us to reduce stress and tension through the shoulders and through the neck by incorporating the diaphragm and the belly. And I'll kind of bring this down a little bit just so I can show you. Through the diaphragm and through the belly, as opposed to through the chest, because the amount of breaths you're taking each day can really add up to the tension that you might be created through the shoulders and through the chest, which can add to associated neck tension and potentially headaches. Meditation is a very new activity that a lot of people are adding into their day and tend to help a lot with stress reduction techniques, or just stress reduction in general. And you can even do, you know, waking up to 5-10 minutes has been shown to greatly reduce the amount of stress in your life, which could, again, equate to a bit of muscle tension and those headaches that we've been talking about. Daily walks kind of goes along with those micro breaks. Healthy relationships around you, great support system, etc. There's a lot of things that come into play with stress reduction techniques that can help reduce muscle tension and ultimately potentially headaches. Limiting alcohol and coffee consumption. So again, great way to start your day with some coffee, but limiting your consumption to, you know, 1 or 2 cups a day as opposed to 5, 6, 7, 8 cups a day throughout the entire day is definitely a good way to go. And it's kind of a steadfast rule that Matthew Walker talked about in his book Why We Sleep. The half-life of coffee has shown that if you have any coffee after the hours of noon, then that typically can result in decreased sleep efficiency, just because of the amount of time it takes for your body to metabolize that caffeine. Typically noon is the cutoff for most people when they're consuming caffeine. And comfortable desk setup is another huge one as well. So making sure that the desk setup, whether it's from home or from the office, is ergonomically favorable and not creating increased tension through the shoulders or through the neck that's unnecessary. And again, potentially creating some headache type symptoms. So we'll go along the sleeping lines here again. So these are just two pictures that I took from actually from Julie's presentation she did the other day on neck pain. And again, this can greatly be associated with any headache type symptoms that present. And this is typically for people who wake up with headaches. So that's obviously one of the questions in the history that we like to notice. If every day you're waking up with headaches in the morning, there's probably something going on through your sleeping patterns that are creating some irritation and creating those headache type symptoms. So with the picture in the top right hand corner, you can kind of see if the pillow is too high or the pillow is too low. It deviates the spine a little bit and then can create some tension on certain joints or muscles as you stay in those positions. So with the pillow at just the right size, again, your spine is fairly neutral and it's very comfortable when you're sleeping and when you go to wake up. And the picture on the bottom left-hand side, this is more so if you're a back sleeper, but just again, maintaining a nice neutral spine. If you find it comfortable to put a pillow underneath your knees or between your knees, that's great as well. So finding those comfortable positions of sleep is a huge factor in reducing potential headache or neck tension irritations. And people always ask me too, if there is a specific mattress that I recommend or a specific pillow that I recommend. Short and fast answer is no. It's very individual based. So some people I know like having a 10-inch pillow top mattress and you're just sinking right into it all nights and that feels the most comfortable for them. Other people, if they have that mattress, they're waking up and they can barely move in discomfort. So they want kind of a more of a firm, kind of a plywood type mattress, and that works for them. So it's basically whatever you find comfortable throughout your sleep, when you can get a good quality sleep and when you're not waking up in discomfort. Same thing goes with pillows. A lot of new pillows now, and they're being touted as orthopedic pillows, and then having a pretty crazy price tag on top of that. It's not necessarily the best pillow for every individual. So I know personally for myself, I like one very small, thin pillow, and that's just how I've always slept and how I like to have how I have a lot of discomfort, or a lot of quality sleep. Sorry. I tried one of those orthopedic pillows just out of curiosity one time for a week, and woke up almost every morning with some pretty significant neck discomfort, not so much headaches, but neck tension or discomfort. And once I went back to my other pillow, those symptoms subsided pretty quickly. So it obviously just that pillow wasn't right for me, but somebody else could have tried it and felt amazing. So playing with different pillows or different mattresses or different sleeping positions can really help reduce some headaches if you do notice almost every morning you're waking up with neck tension or with headaches. And kind of the last little picture that I like to go through here again is that ergonomic desk setup. So a lot of people now are working from home or from the office, and more often than not, I'm hearing that the ergonomic setup isn't quite sufficient. So they're either working from their kitchen table and just a random chair from that table. So you can see picture on the far left, that's creating a lot of tension through the mid-back and through the neck, pushing forward here, creating tension through these muscles in the back of the neck, and looking down more so too, so creating some tension on those neck joints, which could lead to that neck tension and associated headaches. So when you look at that middle picture there, that's more for the seated position. So you really want your desk to have a really nice setup in your chair where you can bring the chair up and down, where it has 4 or 5 wheels on it, so you can kind of move around as you need to. The arms of the chair, you want it to represent a really nice comfortable position, or even just one of those pull-out keyboard stands. If you can rest your arms on those too, that's great. But as long as you can rest your arms so your shoulders are kind of down and nice and relaxed, as opposed to always typing and your shoulders are up here, that's going to create that potential tension into the neck and into the head. And with the screen height as well, you can kind of note where if you're looking at the screen, you want almost the top of the screen to be symmetrical with the top of your head. So your gaze, just your eyes can look down at the screen a little bit. So you have a little bit of obviously a little bit of tilt in the screen as well, but more so doing an eye gaze down toward the screen as opposed to looking straight down from the neck. So that's one of the biggest things we see with with the chairs. And I'm not a huge fan of the back of this chair here. I do like having people having some neck support in the back as well, so you can just kind of lean back and relax. But having a nice back where it is maneuverable and you're able to rock back and forth is very beneficial as well. And then a lot of people now have that standing desk. So again, same kind of concept where the screen is equal to the height of your kind of forehead, and then you're just gazing down with your eyes. Elbows are nice and relaxed, shoulders are nice and relaxed as you're typing away or doing whatever you need to on that computer as you stand. And that kind of comes into those micro breaks or those changing of positions where sometimes you go from sitting, sometimes you go standing, sometimes you're leaning back, sometimes you're leaning to the side, and just creating some variation in that sense. All right, so I think that's about it for the presentation. Just some general takeaway points. So obviously headaches are have a huge socioeconomic burden on the worldwide population, but they are not and should not be something we live with daily. They're usually multifactorial in that there's some lifestyle factors that are involved, there's some muscle tension, there's different things like hydration that could be coming into play as well. So we always take that into account as we go throughout our treatments and our plan of management. Recommended to seek professional opinion for an adequate assessment. So seeing somebody for 5 minutes and then them deducing what is on the go is most likely not possible, because you really want to have a good conversation with somebody, starting with that history about how their daily life looks and kind of what things could contributing to those headache factors, along with the specific structures in the body that could be associated with some tension or discomfort as well. Effective treatments, again, is often multimodal and multifactorial. So again, you want to look at those lifestyle factors, you want to do those therapeutic modalities and some exercises and stretches given to you when you go home, and then the good conservative treatments and care while you're in the clinic itself as well. So yeah, consult with a healthcare provider for a personalized plan, whether that's chiropractor, physio, massage, osteopath, any of those conservative care practitioners that we mentioned before. And if you haven't already and you're interested in booking an assessment, I kind of urge you to do so and get a good grasp on what could be causing the headaches and what can be done to help. If you have any questions that you want to reach out personally as well, my email is amartins, and so first initial last name at protxservices.ca. And again, if you have any specific questions or comments, feel free to reach out whenever you want, and I'll be happy to respond as fast as possible.